I'll never quit. I'll never lay down. See, I promised myself that I'd never let me down. So I'll never give up, never give in.
Hi, everybody. This is Dr. Ed Park, and I want to thank you for joining us for the rebirth of podcasts. This is podcast 46 after a 2-year hiatus. It only took our Lord 3 days to rise from the dead, but the podcast apparently 2 years. First of all, spinal cord injury, or SCI, obviously is not injury of the bones per se, but of the cabling inside. That's motor, that's sensory, and that's also autonomic nervous systems that run in and alongside the spinal column. Of course, the most common reasons for spinal cord injury are trauma, but infection can also do it, often in a transverse fashion. It's like a transverse myelitis, they call it. There are about 1,200 cases a year, and the United States is estimated that 250,000 people currently live with spinal cord injuries. When we look at the anatomy of the spinal cord, it's interesting to see how we're wired, quite literally. The gentleman on the right, who appears to be pop-locking or dancing, is actually a representation of how we're wired. Now, if you see the face is, of course, the facial nerves, and then you get the light green C. Those are cervical spine. On the right, it's indicated by the reddish maroon cervical spine. That's the forwardly curved or lordotic neck bones. The blue in the upper body is the thorax, and that's also bluish purple on the right. That is the curved towards the back kyphosis, or that curvature is the thoracic spine. And then, of course, the bottom 5 there in yellow on the right would correspond to the front of the legs, the lumbar roots. Those are the lumbar spine, and the spinal cord itself ends right around L1, and it becomes a horse's tail, or cauda equina. It's no longer that tight band or tight cord. On the rear of the legs, the buttocks, genitals, is the sacral area, which is again a curvature to the back, or a lordosis, and that's where we get the bowel and bladder control and some of the sexual function. On the left, we see that this cord looks like a butterfly in cross-section, and then inside there's gray matter and white matter. Gray matter, as in the brain, is cells, and that's in the middle, and white matter is long neuron tracts, or axons. That's the cabling, and that runs up and down. It's a very nice little system. The front right at the 4 o'clock position would be the motor neurons, and on the back of the butterfly, the smaller horns, is the dorsal, and that's where the sensory comes in. On the front here, towards your belly button, is where the motor goes out. And then on the gray matter, run up and down afferent to the brain, and efferent from the brain. You get these corticospinal tracts. The lateral spinal thalamic tract takes pain and temperature sensations up to the brain. The dorsal tracts read the position in space. So this is a very great system that has been designed and duplicated in, of course, most creatures like us. Now, the sparing of sensation to pinprick when someone first gets an accident, even if they have no motor control, if you prick someone with a pin and they feel it, that's a good indicator that they'll get at least grade 3 muscle recovery. That means purposeful motion. That's about 85% chance. So it's good news if someone has an injury and they can feel in the immediate aftermath. Just a side note, on the autonomic nervous system, we have what's called craniosacral, which is the cranium, the vagus nerve mainly, but all the other nerves, and the sacrum down at the bottom. So the top and the bottom control what we call the parasympathetic nervous system. This is generally the relaxing, let's say, nervous system. So, for example, the ability to hold urinary continence and the ability to maintain an erection, the uterine contractions, micturition or production of urine is controlled by the sacrum, as is, you see above, the function of the GI system. This is why your mom said don't swim after you eat, because the blood is going to your digestion, and if you all of a sudden start exercising, then you get the blood away from there and you can't get the parasympathetic help that you need. Even though the enteric system is a subsystem, it is influenced by your autonomic system. So in general, the craniosacral is relaxing. That's why they want to massage little babies to relax them. I don't know, there's all kinds of fringe science out there. And when you are anxious and fleeing a tiger, the right system kicks in. The right system is the thoracolumbar. You see that in the thorax, the blue there, and also a little bit in the lumbar. You have these blue signals. These are the exciting signals. So that would shut down the digestion, and also have influence in things like heartbeat, of course, and coughing, and the whole myriad of functions are always in some kind of balance. So, of course, sweating, you see on the left, is also controlled. And instead of being in the protected part of the cord, it runs parallel, this chain of sympathetic nerves. When someone's injured, the prognosis is A, B, C, and D. A is bad. Coming back from that is not common. That would be no motor and no sensory function, including the sacrum. S4, S5 is usually assessed by checking the anal wink, or the sensation and movement of the sacrally innervated anus. This phenomenon of sacral sparing we'll talk about a little bit more, but A is bad. This is the American Spinal Injury Association, I believe, impairment scale. B is incomplete. That means that you have no motor, but the sacrum or the anus is able to react and be somewhat controlled. This is about a third of these get some kind of improvement, and a third of a third, or 9%, I guess, get significant improvement. So B is very bad. C is more common, I think. You get weakened, and about 75% of these people get some improvement. The difference between a C and a D is that a C, at least half of the motor segments below the injury are not grade 3 or better. You can't purposefully move them. And D, you can move over half of the motor segments below the injury, and almost all of these are functional discharge, because the definition includes being somewhat functional at diagnosis. The functional deficits that arise from spinal injury depend, of course, on the level and the severity. Now, level-wise, the diaphragm, the thing that the muscular upwardly curving dome between your abdomen and your thorax that mainly controls breathing, comes out of between C3 and C4. So you can breathe voluntarily if you're injured below that. Now, to diagnose, you look at what's preserved. If you can shrug your shoulders and bend your elbows, and if you can turn your palms up, then you have C5 still intact. If you can extend your wrists, C6 is intact. 7, you can straighten your elbow, it's triceps innervation. Even though there's only 7 cervical vertebrae, C8 is the nerve that comes out between C7 and T1. Big problem for people who don't have great sensory feedback from below the injury is pressure sores. Sensory includes not only pain, heat, position, all these things. Another problem is that people have poor bladder control, so they get stasis, infection, urinary tract infections. Another big problem is pneumonia. Because they can't cough if they have a injury involving the thorax, the ability to clean out the lungs is impaired. Also, the ability to just move your legs, shuffle, feel when there's a problem, tingling, numbness, leads to deep venous thrombosis, as we'll see in our case presentation. Finally, there's different flavors of autonomic dysfunction, which include erectile dysfunction. There's also problems with sweating, incontinence of bladder and bowel. And also there is something called the autonomic dysfunction, which results in high blood pressure. You can have sort of a bottoming out and a reactive high blood pressure, which can be quite dangerous. In general, there is sacral sparing in everything but the ASIA class A, and that includes anal wink, voluntary control of the anal sphincter, and sometimes little control of your big toe. Now let's talk about the why of spinal cord injury. You look at a cross-section of bone, you break a bone, you build a bone back. Look at bone, it's not that big a deal. It's a repeating, simple structure. Same with muscle. They're little bundles, but you tear a muscle, you grow a muscle, no biggie. What's in the middle, purportedly, is a cross-section of undersea optical cable or a communications cable. This is a better representation of what it looks like a Tibetan mandala, for God's sake. And so that's what we saw in the earlier slide. We have all these tracks going up and down. And you have a track running across the ocean or from your head to your toe, actually the head to the cauda equina. These are discrete tracks that are injured. How to replace them is not a trivial task from an engineering standpoint. You look at 4 vines on the right growing up a trellis. When you were a fetus, you grew all together now, as the Beatles would say. And let's say you got a real bad injury to one of these bundled tracks. It's not as though you can just pull that one tract and then regrow that one tract. This is a big problem engineering-wise. Now people say, well, I can cut off a salamander's arm and it'll regrow. Well, very true. Salamanders can de-differentiate to a primitive stem cell state and they execute an embryonic development program. But you can't do that with an injured grown person, because what are you going to do? Sever the entire torso and regrow a torso below the injury? So it's a poor analogy when you're talking about a peripheral limb, which is relatively simpler. You have a program that executes in terms of muscle, connective tissue, nerves, and vasculature. You cannot trash the existing neurological system and just rebuild. So that's what makes it difficult. One of the most promising things in theory is stem cell treatment, because of course stem cells do make everything in your body. There was a trial out of the Geron Corporation through UCI's Hans Kierstead, who was a friend and acquaintance of Christopher Reeve, which initiated in 2010 and due to funding problems subsequently was halted. Ironic and perhaps questionable that the first stem cell treatment would be the most difficult. It's sort of like learning to play Rachmaninoff as your first piano piece instead of Twinkle Twinkle. But that's what they decided to do, and the thing is now DOA. Hopefully it will come back. Geron had a bunch of stem cell lines which they wanted to experiment, but due to whatever financial reasons, they stopped. A better way to look at this would be to look at the analysis of animal studies. They purposefully injure these poor animals. On the right is a chart which I'll blow up for the final presentation. They use things such as knives, drugs, ischemia, compression to cause spinal cord injuries. And in all these studies, and there were many, many thousands of them, what we do see arise is that the p-value, meaning the significance, from using stem cell treatment is infinitesimally small. P-value, as you recall, is the chance that results are due to randomness alone. And so in the first, when you see at the top there, 0.000001 is 1 in 100,000 chance there wasn't a real effect. And the R squared is the correlation. That means that there was a 12% correlation with using stem cells and improvement in the function. So there is some theoretical promise being shown from animal studies. Again, I want to revisit what the problem is again with the stem cells. People want to spend money and go to Thailand or Belize and do stem cell tourism because of hope. And at this point, I couldn't recommend that. maybe for something trivial like a knee or maybe even a back. But for spinal cord injury, I don't care what kind of awesome scientists you have in your fantastic voyage. And think of stem cells as like these factotum cells. They can differentiate into anything you need. Even if you have the biggest geniuses, the crack team of stem cells, and you pour a ton of them in there, what we're looking at is a situation of the middle, a fried motherboard, literally fried. If you have a spinal cord, which we didn't discuss, is not only injured, but the inflammation, the actual repair, causes even more collateral damage. You can send in your crack team of micro specialist stem cell robots, and what are they going to do with that? There's so much infrastructure damage. I think it would be a waste to go to stem cell tourism, and most of what you would recover from function at this time with current modalities and adjuncts would be mostly placebo-derived benefit. On the right, in the 1982 Cal and Stanford game, where the marching band flooded the field before the game was over, having impact. This is the kind of disorganization that we are talking about. If you have the most brilliant musician ever and the concert hall is quiet and they have a score to play from, then they can reorganize. And this can happen willy-nilly or in a more organized fashion throughout the body. But when you're talking about something very, very complicated and hard to recreate, like the central nervous system, I would not think this would be very successful. Porter Broughton is a gentleman who I had the pleasure of meeting some years ago at a Sun Valley Wellness Festival in 2012 that I was invited to speak at. In November the 6th of 2006, he had a motor vehicle accident while driving with his son. He was trying to protect his son who was having some problems of a thought disorder nature, and they crashed, and he had a terrible spinal cord injury at C7T1 with some crush damage above that as well. Unfortunately, they didn't ice it or do any anti-inflammatory or any other therapies, and they did an anterior approach, a laminectomy. 2 of the vertebrae were crushed and reconstructed, but that wasn't until 2 days later when a lot of the secondary damage had already been done. When he returned in January from the hospital, he had only the ability to wiggle one toe. That night, his son completed suicide, and of course it flung Porter into a deep depression, wanting to remain bedridden. And as we discussed before, when you don't move your legs, venous stasis forms and clots will form in the large veins. One such clot formed in Porter's leg and dislodged to his lung, causing a complete cardiac arrest. By some perhaps accidental fate or accidental twist of fate, the 911 call was heard by his neighbor, who was an EMT, and he came right over and administered mouth to mouth. And although it was very questionable whether he would survive, Porter states that he had a near-death experience, and his son beseeched him to return. And so he fought through that and did manage to recover from complete cardiac arrest, cardiopulmonary arrest. In June of 2007, Jill Runyon, who is a therapist, heard about Porter's case and knew immediately that she was called to help him. So she came out and began a journey. For the next 5 years, she did neuro rehab on him with massage, feedback training. Porter had Asia C level damage, meaning his muscle groups really were 0 to 1. He had no purposeful movement, although there was tone and a lot of what we call spasticity. So she worked with him, and after meeting Porter and Jill in Sun Valley, I recommended they try the TA65, which they did. And then about a year and several months later, Porter wrote to me, said, "Hey, I'm a little concerned about the theoretical risk of cancer, but this TA I've been taking really seems to be helping." And it was his feeling that he had made a breakthrough really, as 5 years of not much purposeful movement, after taking the TA, he felt like it would help him reestablish some control, and that was a good thing. Aside from what's been going on with your recovery, what do you notice from taking the TA? Is there anything different about your dreaming or your sleep?
Definitely sleep is better. I never was one to remember a lot of dreams, but I do know now that I dream a lot. Lots of walking dreams, where I see myself walking, skiing, being active again. Let's see. I do think my hair is recovering a bit.
Darker, you mean?
Getting a little darker.
Are you getting more?
A little more.
Really? Interesting.
I know I went to the eye doctor recently and my eyes had not deteriorated. He said, actually your vision's slightly better.
Oh, good.
So maybe that's a symptom of
Maybe.
So now he's holding himself up.
Uh-huh.
He lets himself down and he does it controlled.
Okay.
Very controlled. He's not, that's all with his legs. Gets all the way down, pushes
Wow.
himself back.
See, we're getting some back.
I would say.
Yeah.
I would say. So that strap keeps you from going too far down. You can feel your position in space, like your muscles?
Yeah.
Okay. The VA says that he has a clean bill of health for a 73-year-old. His body is physically perfect. His organ systems are very well preserved. And now his motor function is very good, along with his proprioception and his core postural muscles, which is great. So these pictures are from this year. I was able to take my son Oliver, and there you can see on the bottom right, he's working with Porter, who's doing a lot of his transfers on his own. And he got on the inclined sled for us, and we talked about his progress. There's Jill's wonderful rehab facility called Synapse in Idaho. It's a center for neuroregeneration, and they're open to many different modalities, whatever works to keep the faith. They're big followers of Joe Dispenza, who I don't really know that well, but who does good work, I hear. And they continue to improve. Porter's wife is amazing. Her name is Ann Toy, and she also has thrown down the gauntlet from the beginning that he is going to walk, and Porter and Jill are on board with that. Now, let me ask you, so for the first 5 years after the accident, did he have a lot of sensation? Could he feel below the injury level?
He feels more now.
So there was some sensation, but just not a lot of voluntary movement?
Well, like he couldn't feel pain and he didn't feel hot and cold.
Okay.
But he could tell when somebody touched him. Yeah, I really appreciate your checking in to make sure you've got it right. Because we've dealt with other people that have it so wrong that it's like, oh my goodness, why did they ever think that?
So, you have been taking TA65, now you're taking the recharge. What differences, if any, have you noticed going from one to the other?
I can't say I've noticed any. Checkbook is fuller.
Your checkbook is full. That's good. But the part that I got wrong was the spasticity. Ann Toy told me today while you're meditating that apparently the spasticity is greater this year than last year. What do you think?
Since February, I've noticed that it's gotten really strong. But it could be a good thing because maybe we got enough connection so that the chaos is, stronger, but maybe then it has more do need to realign. I don't know.
Yeah, definitely. Now, in terms of sensation, she said that in the first 5 years you weren't really able to determine pain and temperature as well and position. Are you getting more pain and temperature below the level of the injury now in terms of sensation?
Yeah. Yes, definitely.
Oh, that's good. And voluntary movement, you had been able to move your toe from the beginning. How much movement did you have in the first 5 years? Now, I noticed that you seem somewhat breathless because it's mainly, you don't have a lot of intercostal. Can you cough?
Oh, yeah.
Okay.
Yeah, definitely cough. I think there's some limits on the diaphragm, but coughing, it works fine.
Oh, good. So did you always have your intercostal muscles after the accident, like the ability to really
No.
cough? No.
No.
So when did that start coming back?
Gee. 3 years out? 3 or 4 years out.
Okay, good. So respiratory infection, you really don't have an issue.
No.
Good. And what about, can you feel when the blood is kind of heavy in your legs? Like, would you feel the swelling now?
I think so. I'm pretty aware
Okay,
what's going on there.
nice. And Antoy said that you didn't have any of the sweating or the high blood pressure reflex autonomic problems that you used to have in the early days. Is that true?
Yeah, I never had much
Okay.
autonomic dysreflexia that I know of. And definitely has been years since I'd even thought of those symptoms.
Yeah. Now, when you went to the VA, they gave you a clean bill of health. They said you were as healthy as an ox. All
Yeah.
your blood tests and all your heart and your lungs. Do you feel like your general health is good other than the neurological challenges?
Yes.
Good. When you, if you were to talk to somebody whose family's just a few months out from spinal cord injury, there's a lot out there. A lot of people will try anything. I came down kind of against stem cell tourism.
Yeah.
I know people try and tell you don't get your hopes up. What kind of advice would you give to a family that, is not going to be able to fly to Belize, or, how do they keep reasonably hopeful and positive? What's your elevator pitch on that?
I guess a lot would depend on the family's belief in alternatives versus totally allopathic medicine, including hope and meditation, checking out, let's say homeopathy, different modalities of healing.
Mm-hmm.
And if they were kind of tuned into that or wanted to explore it, I'd say they should definitely have a lot of hope. But
So you started out,
believe.
even before the accident, you're a very spiritual person, I know. But this has just made you more so. What are the prescription medications that you currently take?
0.
0. Okay. So you're not a big
Yeah,
believer in keeping the
No.
pharmacist busy.
No. We don't own stock in Merck.
Okay.
No. I think I'm kind of anti-prescription drugs. Maybe in an emergency, but basically no.
Yeah. Someday, I think, we're getting pieces of the puzzle, but just the very fact that you're getting better is providing hope.
Yeah. I think so.
Well, all right. Thanks for sharing with us, and I'll post it, and it'll be pretty brief, I think.
Yeah. Well, thanks for including us, too.
Okay. Yeah, if I ever get around to creating the Great Souls Initiative, maybe we can try and get some people to donate ease your burden there a little bit.
Oh, that's okay. We're glad to support you. And when's that newer formula coming out?
Oh, it's out. Yeah, I like it. As a postscript, as I was editing this, I saw on Facebook a man who wants a body transplant. I thought it was a joke and proceeded to post that this was ridiculous. My friend, also a Columbia graduate and a prominent pediatric surgeon, laughed that I would even dignify it. But as we answered back and forth, it became clear that we are actually open to the idea. If you read the exchanges, we talk a little bit about the theoretical, and it actually turns to the sci-fi. And specifically, a topic of my graphic novel in which the billionaires of today, having been bamboozled into cryogenic suspension of their heads, are trying to get back into new bodies. In another odd synchronicity, one of the next articles I saw on Facebook was about a man who reportedly regenerated the ability to walk by getting transplantation of his own nasal olfactory nerves. So, I guess the moral of the story is, don't keep too closed a mind on anything. Anything is possible.
So I'll never give up, never give in, never let a ray of doubt slip in. And if I fall, I'll never faint. I'll just get up and try again. Never lose hope, never lose faith. There's much too much at stake. Upon myself I must depend. I'm not looking for place to show I'm gonna win.